the quality of our touch is imperative. One of the lectures that I took with Andrew Nugent-Head, he states, if you don't learn anything else from this lecture, please learn that quality of touch is a huge, significant part of our practice. So what does that mean? It means a lot of things, and I don't think I'm going to be able to explain all of the important aspects of what that means, but I'm going to try to give you some ideas. If a needle is going in and it's always painful, that's not good skill. The goal is to have good enough skill that most of the time when you put in a needle, the person isn't having terrible discomfort. We use a 40 gauge needle, or I don't know if it's a gauge, it's 40 millimeters, and it's a 0.4. In other words, I think it's 0.4. It's like almost half a millimeter in diameter, and we use different lengths. So it's a sturdy needle. It's a very sharp needle that goes in smoothly, and the skill of touch means that the more points of touch in this situation that I have, in other words, I have my hand touching the body in many parts of that, in that area, I kind of diffuse the attention of the patient on that area and then pinch the area. We're going to talk about trapping, or trap the area that I want, and then at the same time that I insert, the supporting hand helps the insertion. So there's this harmony. And notice my body. There's some harmony in my head going down. I'm exaggerating the movement. I'm going in. I'm not going, oh, back. Because if I hesitate and go back, the person is going to feel it.